The key to solving back pain is there's two things, well, maybe three, but number one is knowing what your problem is or what's causing your pain and any sort of underlying cause that may perpetuate the pain, and then making sure that you solve the problem in the right sequence. But the key is truly to understand the nature of back pain and what some of the causes are. So the more you watch these videos, the more likely you are to live pain-free forever. Total back pain relief for a lifetime. That is my goal. So I want you to subscribe, but I also want you to share this with your friends and family, and certainly like it, because that's good for YouTube. So somebody recently came in with a herniated disc, and the question really is, what are some of the underlying causes? Well, an old injury to an ankle, sprained ankle, a slip, a twist, things like that to the ankle can actually lead to a herniated disc. And the question is why? Because when you understand why, you're more likely to make sure it doesn't come back. Because if you don't solve the why, it will come back. And it has everything to do with the way the nerves communicate with the muscles after the injury. What can happen is you can develop what's called glute amnesia. I suffered with back pain for 10 years. My back pain went away. I had a herniated disc. I've been studying this for 30 years, and we've been doing a lot of research that has been published about what causes back pain, the best way to treat back pain, 26,000 patients. You can access us through PubMed.gov, but this is about old ankle injuries that lead to herniated discs. Now, what can happen is you can twist your ankle, and the way the nervous system communicates, what happens, it'll slowly shut off the nerve to the glute. And we've talked about the glutes in the past with glute amnesia, but this is another case where you can develop glute amnesia. We know it can happen when you sit. And typically when you get it when you sit, you get it in both glutes. But very often when you have an ankle injury, you'll develop it in one glute. And that's a whole nother set of problems, because that causes lateral stress across the disc. And the way you sort of move and the way you walk, and very often the hips will drop down because one side's weaker than the other, which then keeps loading into the disc. But what we know is an ankle injury can actually neurologically slowly turn off the glute. Okay, it's part of what we call reciprocal inhibition, but there's other causes as well. But slowly the glute will turn off on one side, so you'll have sort of an imbalance. The glute obviously is the muscle that you use when you squat, but it's also used when you get in and out of a chair, in and out of a car, on and off a toilet, bend to brush your teeth, things like that. The glute is very, very, very important. So how does this happen? Well, 24 vertebrae between the head and the hips, the vertebrae are the bones. In between each bone, there's a disc. Disc allows for motion. Disc is like a jelly donut, in the sense that the outside of the disc, there's a very thick material. Inside the disc, there's a jelly. What can happen through repetitive bending, and when you have glute amnesia, you tend to bend with your spine as opposed to bending with your hips. And the reason you don't bend with your hips is because the hips aren't strong enough to support you. So then you start to bend through your spine, because you don't have to be as strong, because the ligaments hold everything together, but it's very detrimental to the disc. So what happens is that disc over time can start to get aggravated. Nucleus can start to push out. You can develop a weakness. Bending causes the annulus to wear out. And that annulus, as it wears out, starts to tear. And as it starts to tear, what will happen is you'll develop the herniation. So it's really a combination of the muscles going out of balance that eventually starts to cause the herniation. And it's from the repetitive bending on the spine, because the glute is weak and the glute is inhibited. There's inhibition to the nervous system, the communication to the muscle. We call it a software problem. Okay, sometimes they say, oh, I have a hardware problem. There's something wrong with my bone. There's something wrong with my disc. Yes, you have a disc problem, but you also have a software problem. And the software problem is going to perpetuate this sort of bending pattern that's going to cause the disc to herniate. And it's all the result of the glute amnesia. Now, here's the deal. There are a lot of treatments for the disc. There's a lot of different types of treatment for the disc. But the disc is only bad because of the glute amnesia. And again, it's a nervous system problem. The nerves aren't communicating properly to the muscles. So what you have to do is you have to reactivate the muscles. But over time, you'll develop the lower cross syndrome because the nervous system's not doing what it should be doing. It's not telling the muscles what to do. It's slowly starting to shut off. And then what happens is, instead of using this muscle here, which is the largest muscle on your body, you start to bend here. And when you bend here, it's like hitting your thumb with a hammer. After you develop the herniation, if you keep whacking it, if you keep bending on it, you're going to get central sensitization. This is complicated, but this ties it all together. And again, if you want to live pain-free, you have to solve some of these fundamental problems. We've developed a program. It's 5 phases. Phase number 1 is the healthy movement patterns. It's a fundamental. It's fundamental and instrumental to you eliminating your problem. You have to move properly. When you don't, you start to have problems. And you perpetuate it. Talk to somebody today, they're like, I used to be able to do all these things. Pain and come and go, come and go, come and go. Okay, it's right here. It's the healthy movement pattern. But then you have to create stability. You have to create the endurance in the muscles. You have to restore the motion to the glute. Okay, and then you have to reactivate the glute. Then create the functional strength. You have to have the ability. Glute amnesia equals poor movement. You have to retrain the body and retrain the nervous system. If you don't reactivate the glute, which should be glute, the pain's not going to go away. So if you fix the disc, but you don't fix the glute, if you don't fix the glute, the gluteus maximus, you're going to continue to bend wrong. And when you continue to bend wrong, you're going to aggravate the disc. There is a proper sequence. You have to do the work in the proper sequence. If you don't, or if you don't get all the sequence accomplished, pain comes back. Trust me, I know. 10 years I had it. 10 years. I saw everybody. Nobody. The problem is I had so many things going on there. They fixed one, but it didn't solve all of them. You have to solve all the problems. That's what our program's designed to do. Solve all the programs. You can do this. Take the pressure off the disc, alleviate the sensitivity, reactivate the muscles, have you bend better, you will get better. And it will prevent future episodes of back pain, which is the key. Okay? There is hope. There is a way out. Even if you've had surgery and didn't get better, there's a way out. I promise you, you can get better. This program lets you take control. Okay, we're in an environment right now where we don't feel like we have a whole lot of control and it doesn't feel very good. Okay, if nothing else, get control of your back and your life gets better because everything's going to get better.